Welcome to all of you joining us for the San Diego County Medical Society Physician Wellness webinar. I'd like to thank you for attending. My name is David Bazzo, and I am the chair of the San Diego County Medical Society Wellness Committee and a past president of the County Medical Society. And just by way of a little bit of history, when I came into my presidency, one of the focuses that I had during that time was on physician wellness. That was all pre-COVID, by the way. And we had been seeing a lot of surveys that were coming out about just the extremely high rate of physician burnout and problems with our colleagues. And so I felt that it was really an important flag to wave, bringing highlight to the issue of physician well-being and wellness. And after my presidency, well, during it and then afterwards, we were able to get started with a wellness committee. And the speakers that you are going to be hearing this evening are all part of that wellness committee. But just know that your San Diego County Medical Society takes our members and all physicians' wellness very, very seriously. We're here to help. We're here to offer resources to you. And this evening, we're very delighted to be able to share some really important information about different aspects of physician wellness. And all of our speakers are really just phenomenal people and are experts really in the field of physician wellness and have just done such a fantastic job that I'm really excited to have them here this evening to share information with you. The way this evening is going to work is we will have talks from each of our four speakers this evening, and those will last approximately 10 minutes or so for each of the presentations. And then we've really laid out some time at the end for us to have a Q&A, a discussion, a back and forth, really with regards to all issues surrounding physician wellness. I'm going to go ahead and share some slides and get some of the logistics out of the way here, because I think it's really important that all of you be able to get credit for attending this evening. And we are very happy to have a sponsorship and partnered with the Doctors Company, who has been extremely helpful in getting CME credits for this. And these next few slides here are going to be ways that you can check in to the meeting. And after you've checked in, there'll be at the end a way to check out, and then you will be able to get credit. We're going to be giving 1.5 CME credits for this session this evening. So for those of you that have your smartphone handy on the screen here, you'll see a QR code. You can click on that and it'll bring you to a website. It's called doctors.cnf.io. Then it will just ask you to check into the session and you'll be providing some information. For those of you that want to use your laptops and a traditional web browser to get into the check-in, this is the information here. Again, doctors.cnf.io. And you're going to type in your name in the search bar here, and it's going to be the physician wellness presentation, and that's how you'll get it. Now, you will be receiving your CME credits within about 7 to 10 days after submission. And you will have up until October 13th at 5 p.m. to be able to check into this webinar. We are recording it, so it will be available beyond this evening. All right, a couple of other logistical things with this being a credit seminar. I just wanted to talk about our accreditation disclosures and disclaimers. And again, our 1.5 AMA PRA credits are being provided through the Doctors Company, which is an accredited CME provider through ACCME. I do want to state that individuals that are presenting this evening have no conflict of interest with regards to patient items or activities. You will be hearing from them about potential organizations that they are involved with, and they will do that on an individual basis when it comes time for them. But also this is being offered for informational and educational purposes only from a patient safety risk management perspective and does not constitute any legal advice. I will let you read that last paragraph there, which is completing the disclaimer for this evening. So what are our objectives for this evening? Well, we've come up with 4 different objectives to go through, and hopefully by the end of this evening, we will have fulfilled each of these objectives. But the first is to describe the science and the benefits of gratitude as it relates to physician wellness. We're then going to talk about recognizing the signs of burnout and discuss its impact on physician well-being. We're going to understand the benefits of professional and peer coaching for physicians to improve physician well-being. And then our final objective is to discuss the importance of mindfulness in medical practice and how it can improve the quality of medical care that you are delivering to your patients. So I'd like to just take a moment here as the final part of my introductory remarks to go ahead and introduce our panelists that will be delivering information to you this evening. The first presenter that we will be having is Ami Doshi, and Ami is from Rady's Children's Specialists of San Diego. Our next presenter after Ami will be Byron Ferguson. Byron is with the Anesthesia Service at UC San Diego Health. Our next presenter is Ni-Cheng Liang, and Ni-Cheng is a pulmonologist with Coastal Pulmonary Associates. And then our final presenter this evening will be Jeffrey Smith, who is an orthopedic trauma and fracture specialist who has done a lot with physician coaching. So again, we're in for a really great evening. Please utilize on your Zoom meeting at the very bottom, probably right above where I'm pointing, you will see a little tab there that says Q&A. So we want to definitely get to your questions. We will not be answering questions during the presentations. However, when we get to the end and we're in our roundtable, we'll make sure to get to all the questions, but please utilize the Q&A function to bring up those things that you'd like to have discussed, and we will get to that with the panelists as we move on. I also want to for those of you that are members of the San Diego County Medical Society, thank you very much. It is part of the advocacy that we do for our members and for all of the physicians of San Diego that makes programs like this possible and keeps our wellness committee going. And for those of you that are not members, I would really like to wholeheartedly encourage you to consider membership in the County Medical Society. And it's really a worthwhile organization that can bring a lot of benefit, and not only to yourself, but to your colleagues around you. All right, so with all of that being said, without further ado, I would like to go ahead and introduce our first speaker for the evening, Dr. Ami Doshi. Dr. Doshi.
Hi, thank you. I am, as Dave mentioned, at Rady Children's Hospital and am the Wellbeing Director for the Department of Peds at UC San Diego. Let's see, we practice this. Will it work? Maybe not. Sorry, let me try that again. There we go. Okay. Okay, there we go. So to anchor us a little bit, we often talk about physician burnout, which you're all familiar with, which is that syndrome of emotional exhaustion and depersonalization that creeps into our experience as doctors. Definitions of physician well-being are a bit more varied and hard to come by, but there's one from Mickey Trockle, which really calls to me, and he defines it as physician well-being is defined by quality of life, which includes the absence of ill-being and also the presence of positive physical, mental, social, and integrated well-being that ultimately allows physicians to develop their full potential across personal and work-life domains. So as a palliative care physician myself, any definition that includes quality of life really calls to me, and I really like to think about physician well-being in this way. But why does physician well-being matter enough that we're gathered here on a Wednesday evening to talk about it for an hour and a half? So you all are familiar with the triple aim of medicine, which is to improve our patient outcomes, improve the patient experience, and then to do so with lower costs. Around the same time that this framework was being implemented, it was also noted that physician burnout was on the rise. And what has become evident is that physician burnout adversely impacts each of those other aims of the triple aim. So when we think about patient outcomes, we know that physicians with high levels of burnout have a higher propensity to make medical errors in the 3 to 6 months following whenever we assessed them. We know that patients of physicians who have high levels of burnout experience longer recovery times post-discharge from the hospital. And we also know that they might experience decreased levels of empathy, which then translates to decreased adherence on the patient side to their treatment plans, which of course is going to adversely impact patient outcomes. If we're talking about decreased levels of empathy and the impaired professionalism that physicians can experience when they're burned out, they might very well be exhausted, they might be irritable, they might not be sleeping well, there might be issues of substance abuse. All of those things can trickle down to the patient and also adversely impact the patient experience. And then we all know that physicians who are burned out often respond to that by either cutting back their hours or leaving the institution entirely or leaving the field of medicine entirely. And by now the financial case has been well developed, and it's really clear when we lose a physician to burnout, the cost of replacing that physician, depending on the specialty, is 2 to 3 times their salary and can range from $250,000 to $1 million per physician that we lose to burnout. And so this is costing the healthcare system, it's been estimated $4.6 billion, and that's not accounting for any costs that might be incurred due to like overuse of resources that a burned out physician might be engaged in. And so it is abundantly clear that you cannot meet the triple aim without also attending to the clinician experience. And so that's why we've moved now towards this quadruple aim model that includes an improved clinician experience and attention to physician well-being as part of the aims of healthcare, in recognition that you can't meet the other 3 aims if we're not going to take care of our physicians. You're also all aware of the significant prevalence of burnout. That's again why we're here. It tends to be around half of physicians who are surveyed at any given time tend to be experiencing some degree of burnout. And so if you think about a public health crisis, you're thinking about prevalence coupled with impact. And so that prevalence is not to be disregarded, and that's not even accounting for our med students and our residents and some of our trainees who are also experiencing burnout. When you think about how many physicians are affected, how many patients they touch, and then the impact that I just laid out, there's no question that physician burnout is a public health crisis, and this is probably more evident now in the midst of a pandemic than it ever has been before. So when we think about how to address professional fulfillment and diminish burnout, this comes from the Stanford WellMD model. These are the 3 domains of personal fulfillment. So the first is personal resilience. This is what you've probably heard the most about, and this is really important because we as physicians do need to be resilient to the ongoing stressors that we will absolutely face throughout our careers while systems level change is occurring. It's been shown that resilience is protective against physician burnout, and it has also been well established that physicians as a whole are very resilient. It's also been shown that while resilience protects against burnout, almost a third of physicians who have the highest possible resilience score still experience burnout. And so clearly resilience, while very important, is not enough if we're really going to create professional fulfillment. So that's where these other 2 domains come into play. And those are the purview of the organization. Efficiency of practice is really looking at our day-to-day work. What is our scheduling template like? What's the EHR burden? What does our team ratio look like? How does our work flow throughout the day? And then the culture of wellness is really getting at what are the values of the organization? What is the leadership like? Do people feel appreciated? Is there a sense of community? And what is the values alignment like? And so all 3 of these are going to be really essential if we're going to move the needle on professional fulfillment. When we look a little bit more deeply at what are the drivers of well-being, they're all the things you see here, which probably none of these come as a surprise to any of us. Having autonomy, feeling like our work is meaningful, having means of optimizing our efficiency, these are all going to impact our well-being or our burnout. And just as a snapshot of some of the things that I have heard over the last few years at Rady's and at UCSD, it gets at the same thing. So nationally, this is what we're finding. Locally, this is what we're finding. We want to have a say. We want to feel valued. It's hard to face that administrative task burden and on and on. So when we're trying to address physician burnout, the question often arises, should we focus on individual level or organizational level burnout? As we talked about, resilience and individual level interventions are incredibly important. Both levels of interventions are associated with reductions in burnout. However, it's also been shown that organization level interventions are more effective, particularly when they target the arenas you see here: structural changes, teamwork, communication. And so this tells me that individual level interventions are necessary but not sufficient, and they really need to be part of a larger organizational level strategy, which might include finding ways and protecting time or creating value around the opportunities for some of these individual level interventions. And you're going to hear a lot more of some of these opportunities from my colleagues who are going to speak tonight. And so I'm going to focus, as we think about the path forward out of burnout, on things that can be done at the systems level or the organization level. So one opportunity to really impact physician burnout when you think about the organization level is geared at career fit and meaning in work. So we know that when physicians are able to spend at least 20% of their time in that part of their job that they find most meaningful, they're protected against burnout. And this might be an opportunity for you to think, or even put in the chat what part of your job you find the most meaningful. So if we know that that's true, then this is an opportunity for individuals, local leaders, and organizations to really come together to optimize career fit and optimize meaning in work. So I, as an individual, can identify, here's a part of my job where I find the most meaning. I can work with my division chief or my local leader to identify ways to optimize those skills and opportunities to participate in those types of activities. And they can harness my energy towards things that might elevate the team as a whole. And meanwhile, the organization should be focused on finding ways to streamline all the other elements of our job, the EHR, the task burden, the schedule, all of those elements, compensation, valuing the non-clinical things that we do, to allow us to create more time and value around those things that we find meaningful. And so if we can work together, 20% is really not an unattainable threshold if you really stop and think about it. And that brings us to workflow optimization. So this is something that's been adopted by a lot of organizations across the country and locally. And this really gets at optimizing staffing ratios and making sure that everybody is working sort of at the top of their license. So a common model is to increase the MA to physician ratio, and then also to expand the role of the medical assistant in the clinic or whatever setting they might be in. And in that way, some of the tasks that maybe traditionally have fallen to the physician are now being taken on by the MA or other members of the team. There's a better sense of teamwork. There's huddles. Pre-COVID, people were co-located, and all of this has been found to improve satisfaction on the physician's part, improve satisfaction on the MA's part, as well as improve satisfaction on the patient's part, because they experience a more streamlined flow. And sometimes this can even increase productivity and you can get more patients through. So the possibility of that productivity and offsetting all the costs of burnout that we already talked about is really likely worth the investment it might take to optimize our workflow in this way. Another intervention that any organization can employ, and which CMA actually did for us last year, just as the pandemic was taking hold, is the idea of fostering community and meaning in work through structured small group interventions. So it started at Mayo, but other organizations do this. They create protected time or create funding around the opportunity for physicians to come together and discuss the physician experience. And this has been shown to decrease burnout, improve meaning in work, and to do so in a sustained way that lasts even a year after participation in these kinds of interventions. So this is another, again, really feasible way for an organization to foster physician well-being. And then lastly, you can't really talk about physician well-being without considering the role of leadership. It's been very clear that the leadership so the way we rate our local leaders, so I'm not talking about the C-suite, I'm talking about your immediate supervisor, their leadership scores directly correlate to the well-being of the people they are leading. So the higher somebody is rated as a leader, the more well the people who they are leading tend to be. And this accounts for nearly half the variation in well-being scores of physicians. Similarly, the well-being of the leader also directly correlates to the well-being of the people who they are leading. And this comes as a surprise to nobody. But this tells me that it is really important that we cultivate our leaders and develop our leaders in a way that allows them to, number one, be well, and number two, lead well, so that they can impact the well-being of the physicians who they are leading. And then before I hand it off, I just wanted to highlight a few quick resources. So the Department of Pediatrics Wellbeing website has a lot of resources, particularly around individual tools and assessment. And then if you're thinking about more systems level intervention, both the National Academy of Medicine and AMA Steps Forward are going to have some really concrete ways that you can walk through some of the interventions I've talked about and a lot of other ones. And then of course, there's our UCSD Center for Mindfulness, which has a lot of beautiful programs that can support our well-being.
Fantastic, Dr. Doshi, that was great, and appreciate, running through all of those. And I know that we'll definitely get back to some of that stuff during the discussion period. All right, let's go ahead and bring on our next speaker, Dr. Byron Ferguson. Dr. Ferguson is going to be going over gratitude. Byron, hand it off to you.
Thank you very much. And make sure I'm sharing okay. All right, can you hear me okay? Great. Thank you, Ami. That was fantastic. And that's a very good segue into what I'm going to talk about. And really what this is just a simple, practical, cheap thing that has a surprisingly enormous effect on morale. So I'll start off this talk, theoretically, if I can move my, there we go. I'll start off with a case study. So this is a totally theoretical 46-year-old anesthesiologist who almost kills someone at 7 a.m. because of a difficult airway. But still, he has to work to 5 p.m., does a half dozen or so cases, and he gets home tired, emotionally drained, walks in the house, and hears, "Can you take out the garbage?" And the first thing that he thinks is, do you recognize what I did? So another totally fictitious physician, 45-year-old pediatrician, half day in clinic, but still has 3 hours of charting to do. So essentially a full day, picks up the kids and drives them to swimming and basketball and all this kind of stuff. She just needs one thing off her plate for the day, but the first thing that she asks, she just hears no. And she wonders, do you even recognize what I do? And so this trash becomes this atomic bomb. And the trash is innocent. There's nothing that it did. It's just this stress that is accumulating and is just not recognized. But in the end, the trash does not get taken out efficiently. So let's start over. What if, when the anesthesiologist came home, the pediatrician spent 4 seconds and said, "Hey, I really appreciate how difficult work must have been for you today." And then the anesthesiologist takes 2 seconds to say, "Thanks for all you do for our family." Things would be significantly better. What if they just recognized each other and understood what is happening in their lives? And I think, you can only take the marriage metaphor so far when it comes to physician-colleague relationships, but they are truly unique. They're not like law, they're not like business colleagues, and that's not to say that those relationships are any less, they're just different. Our relationships are more like soldiers and firefighters, and the reason is we share life and death. And the emotional depth of our relationships should really reflect this. And I think that when we don't, we do ourselves a disservice, we do our colleagues a disservice, and we do our patients a disservice. And I think the literature shows this. So here's the problem that I have. I hate flowers and rock gardens. So if we look at kind of the wellness space now, there is a lot of this kind of fluffy stuff. And it's hard for me to take in the fluffy stuff when, like I said earlier, I'll have days where I almost kill someone, or I have blood on my shoes, or, you know, I do watch someone die. It's hard for the chocolates and the flowers and the rock arts. So really, am I trying to say that my life would be better, your life would be better if someone gave me a high five as I walk down the hall? I'm saying yes, it truly is. It truly does help. And I have a lot of experience with it so far. So let's talk about the practical aspects of this. The science. I'm not going to go too far into the science. Other than to say there's a ton of it. So if you record yourself once a week listing 5 things you're grateful for in the previous week, it improves outlook and exercise habits. So you're more likely to jog if you say thank you to someone, which is kind of strange. It improves your sleep, both in quality and duration. When directed towards others, it's rarely reported as awkward. And improves the positivity and happiness of both the giver and receiver. So it's not just the person that hears the thanks, it's actually the giving of thanks. And of course, it increases social connectedness, but it also boosts personal energy, increases optimism, improves psychological well-being, increases happiness, improves self-esteem, improves memory, aids in relaxation, and improves the quality of patient care that we give. And it seems crazy that it can do all this stuff. But like all things, it's just related to stress. And stress is good when you're being chased by a saber-toothed tiger or a bear, but our bodies are only made for about 2 minutes of that and just can't handle long-term effects of stress. And the best quote I've ever heard about stress is, "I've been through a lot of terrible things in my life, some of which actually happened," by Mark Twain. And basically what he's saying is that we have this understanding of our idealized life, and then we have an understanding of our what we think our real life is, and then that discrepancy is this baggage that we carry around that causes us stress, as if we're being chased by a bear at all times. What gratitude does is it promotes acceptance. So if I thank myself for something I did, I accept myself for who I am. If I thank someone else, I accept who they are. If I thank someone for a situation, I'm accepting these aspects of my life. And if we look at a lot of the contemplative therapies or mindfulness, yoga, etc., that's a key component, is having acceptance for what's going on. So what am I even talking about when I talk about gratitude? There's a lot of definitions. The best one that I've seen is gratitude is appreciation of what is valuable and meaningful to oneself. And this is extremely important because it means you have to recognize what is valuable and meaningful. And then when we're doing this gratitude at work, we're having to find that meaning in our job. So basically what it's doing is promoting self-awareness, or in this case at work, it's group awareness. And if you look at a lot of these positive psychology therapies like acceptance commitment therapy, dialectical behavioral therapy, MBSR, CBT, MSC, et cetera, this is a key component of it, is self-awareness. Now, stepping back a bit and looking at the key drivers of burnout, autonomy, mastery, and purpose, I would argue these all revolve around recognition. Of course, you can do things on your own when no one's around, but really when we're talking about autonomy, we're talking about being recognized with autonomy. And we're talking about mastery. Of course, you can, if you're on an isolated island and you're fishing, you can master the fishing. But really what we're talking about, again, is people recognizing our mastery, recognizing me as an anesthesiologist. And purpose is often shared. So really all of this revolves around recognition. And in my department, I wrote a horrible survey that I would never do again. But one of the things I did was I had a whole bunch of spaces for people to write stuff in. And I got 700 to 1,000 write-in responses. And the interesting thing is I could pretty much do all 700 to 1,000 into 3 things: having a voice, feeling respect, and compensation. And all of these things revolve around recognition. To have a voice, it has to be recognized. Respect is just recognition. And even the compensation was never, I want more money. What the compensation was the request for compensation was, I want my pay to reflect my value. There was always that value thing as part of it. Okay, so from a practical standpoint, this is something you can do right now for free starting tomorrow. So what I did in that survey is all I did was I put, if you'd like to, please mention someone you feel gratitude towards. And then when I got those answers, I emailed it to that person, our chair, just something simple. Hey, someone recognizes you. And then our chair replied with some kind words. And I got texts and emails and phone calls about like, was this meant for me? What is this all about? Was this a mistake? Wow, that made my day. I didn't know people appreciated me. Thank you so much. Thank you so much. What a great department we work in. And this was consistent. I'm still getting it with our continued gratitude efforts. And that continued gratitude efforts is just a simple survey that I put on something called Suggestion Ox. You can do it for free. It's an anonymous feedback site. And I just said, hey, you know, if you want to say thanks to someone, just put it here. And I also made sure that we didn't forget our surgical colleagues. And we've had plenty of thank yous to other services. And every time I email them, they're always very grateful about their gratitude. It always seems to increase the bonds between our specialties. All right, so where do we go from here? So when I first kind of got into, I guess, for lack of a better term, the wellness space, I always thought that there was like a bad guy. That the reasons that I have problems is because there's someone out there making the problems. So a lot of what I did was confront the bad guy. And what I've learned is that there is no bad guy. There's no one out there trying to make things bad. Every time I brought up the problems to the bad guy, they would say, oh man, I had no idea. Thank you for telling me. Or I know that, and here's the 5 things that I'm doing about it. Or I know that, but there's nothing I can do right now, but I promise to come back to this. There was never a true problem. And so what I realized is that there isn't a bad guy, there's just bad communication. And what gratitude, as another word for recognition, does is it really opens up these communication lines. And just as an example, what about the communication between anesthesia and surgery? And I can't think of a more codependent pair of specialties. We often have complaints about, you know, surgeons not recognizing what we do and kind of making demands. And, you know, when I bring this up to surgeons, they also say, hey, you know, you guys aren't recognizing what we bring to the table. No pun intended, but what we do. What if we just started recognizing each other? I tell you that the trash will be taken out way more efficiently. You know, we have better patient care. We have better work-life balance. And it all really just comes down to gratitude and recognizing each other. And that is all I got. Thank you very much.
Excellent. Thank you so much, Byron. That's good stuff. And you know, I know in the discussion later, we'll be talking about some of the pilots that we are doing towards that app-based things, which should be really interesting. All right. Well, our next speaker for the evening is Ni-Cheng Liang. And Ni-Cheng is going to be really focusing and doing a deep dive on mindfulness. So Ni-Cheng, let's hand things over to you.
Thanks so much. And that was a great talk, Byron, which segues really nicely into mindfulness. I am a owner and CEO of Awaken Breath. It's a mindfulness company. And why is a pulmonologist talking about mindfulness? I want to share a little bit about my story. So 10 years ago now, I was diagnosed with a very aggressive form of breast cancer in my second year of pulmonary fellowship. And it was during that time of needing to take time off to take care of myself, realizing that allopathic medicine saved my life, but it was integrative medicine approaches like mindfulness-based therapies that continue to this day to maximize my quality of life. And it was with that experience as a cancer patient that I came back into medicine a year later, very passionate about advocating for physician wellness, because I just lived the adage that if you don't care for yourself, you really can't care for anyone else. And so I have been involved with teaching mindfulness to all levels of trainees for the last 10 years, inclusive of attending physicians, healthcare administrators, as well as my patients. And talking about gratitude, the picture of me on the right is when I had lost every single piece of hair on my body. And I became very acutely aware of gratitude for hair, specifically nose hair, because otherwise I just had a chronic runny nose all the time. So we'll be defining mindfulness. I'll go over briefly the literature with regards to mindfulness and physician well-being. And then I hope to give you some tips that resonate with you that you can apply immediately after this talk, and more about how you can deepen your own practice and skill of mindfulness. So by definition, mindfulness is nothing more than paying attention on purpose to the present moment without judgment. And how it's practiced is usually that there's a focus on a chosen target, like the breath is oftentimes used. You pay attention to that, and your brain is inevitably going to wander because it's a human brain, and that's what brains do. The moment of mindfulness comes when you refocus your attention back on the focus of attention. You observe the wandering and you begin again, and all of this occurs non-judgmentally. So during a formal mindfulness practice, if you notice mind wandering and you choose to bring your attention back to the original focus of attention, those are all moments of mindfulness that increase our capacity to be mindful. And if you practice long enough, you can invoke neuroplasticity of our brain. We can wire our brains for the better. As physicians, we are highly, highly attuned to the sympathetic nervous system. So our amygdalas are very, very well developed. And so what mindfulness does is it helps to upregulate sites responsible for compassion and empathy, and downregulates the fight or flight response. The seminal article that was published in 2009 in JAMA by Drs. Krasner and Epstein showed that a CME mindfulness course did help to reduce characters of burnout, even a year and beyond at follow-up. Similar studies have been reported as well. This 2014 article was through the Mayo Clinic with Tate Chanafelt, and it combined mindfulness along with small group learning and sharing, with similar results with regards to decreased characteristics of burnout. We also know further that medical students benefit from mindfulness in that it can help them become better physicians by increasing empathy. It can also help cultivate a culture of wellness early on by prioritizing their own self-care and increasing their own capacity for self-compassion. So we know that mindful practice can help bolster all different aspects of our practice of medicine, inclusive of physician well-being, improving our quality of care, and also our quality of caring. So I wanted to leave you with a couple of different resources. So some mindful mnemonics that you can use in the moment of stress, anxiety, or discomfort. So stop, literally pause, take a mindful breath, and then observe by naming the emotions that you're having at that particular moment in time, as well as the body sensations that you have. By naming your emotions, you can actually disarm the amygdala, and you can step out of a stress automatic reactivity cycle, and therefore potentially see some different options where you can have healthier responses to proceed with greater skillful action. You can also use the RAIN acronym. The RAIN acronym is helpful for times where self-compassion is needed. The last year and a half, we've witnessed so much suffering. There's been so much suffering amongst healthcare professionals, both professionally and personally. So RAIN allows us to recognize the situation for being difficult or anxiety-provoking, allowing and accepting the situation just as it is in that particular moment in time, because it's already here and it's already affecting us. Investigate is to observe similarly in the O of stop, naming emotions and body sensations. And then to remind ourselves that the particular situation that we're in causing difficulty is possibly going to happen similarly again in the future. and probably has already similarly occurred in the past with a different situation. And so to try to not take it so personally, and also to not be so hard on ourselves with regards to how we are reacting to the situation. This N is also an opportunity to ask ourselves, what can I do for myself? What is it that I need in this moment of difficulty? So in difficulty, stop and let it rain are moments of mindfulness that you can apply. During the pandemic, lots of different ways that you can incorporate mindfulness every day. We're washing our hands a lot, so you can use the alcohol gel, water, soap, and notice the actual sensations of these different liquids on your hands. You can be mindful about donning and doffing your PPE by noticing the sensations of the cloth or the fabric atop your head or over your face. You can notice right away, asking yourself the question, where are my feet? As a way to literally ground yourself in the present moment. You can also take what's I like to call stethoscope breaths. I have no bias because I'm a pulmonologist, but I think breath sounds are the most important part of a physical exam. And while the patient is taking deep breaths so that you can auscultate their lungs, you can also take deep breaths along with them, upregulating your vagal tone and parasympathetic nervous system during the clinic visit. When we were residents and med students, one of our senior residents probably told us, eat when you can, pee when you can, sleep when you can. And clearly as attending physicians, that's not conducive to our own health and wellness. So I urge all of you to give yourself permission to take your lunch break and to actually sit down, not multitask while eating lunch, really look at your food, taste it, enjoy its different textures, giving yourself that literal break in the middle of the day, which will help you reset for the rest of your day. You can also use mindful breathing. Breath work is a very fast way to activate vagal tone. So the 4-7-8 breath is taught by Dr. Andrew Weil, the grandfather of integrative medicine. So how it works is you inhale through your nose for 4 counts, you hold for 7, and then you breathe out through pursed lips for 8 counts. You can also do purslip breathing. This is taught in pulmonary rehabilitation. You inhale through your nose, and then you exhale for 2 to 4 times longer than your inhale. Box breathing is taught to Navy SEALs. You inhale for 4 counts through your nose, hold for 4 counts, you exhale for 4 counts, and you hold for 4 counts, and you repeat. So all of these different breath maneuvers can be repeated for 3 to 5 breath cycles, but I wouldn't recommend doing that more because otherwise you breathe down your CO2 and you might become dizzy. You can also implement mindful communication. So mindful communication takes into account more active listening and appreciative inquiry, where we allow the storyteller to basically share without interruption, and questions after they're done sharing are focused around clarification, drawing out positive attributes that you noticed. So therefore not talking about yourself, not giving advice, and not judging what was just said, really providing a safe space and holding space for another person in this mindfully communicative way. There's an article published from mindful.org that provides additional tips for incorporating mindfulness every day. Cultivating mindfulness is kind of like exercise is to improving our aerobic and anaerobic capacities. We can watch all the videos that we want about exercise, but unless we actually practice it, we won't improve our muscle mass or our aerobic or anaerobic capacities. So similar with mindfulness, you can try guided meditations on your own for free on my website and also through UCSD's compendium of different audio recordings. A lot of the different apps out there right now related to mindfulness meditation have free subscriptions for healthcare professionals that you can check out. And then you can check out the mindfulness-based stress reduction program that's offered at UCSD, and I also teach it. And if you want to learn how to teach it, I highly recommend checking out the mindful practice programs put on by University of Rochester. A couple of years ago when I was at UCSD as the executive director for the Center for Mindfulness, I was awarded an internal grant to record 1 to 5 minute mindfulness videos. And so these are freely available online, and you can access them 24/7 should you need a moment of mindfulness that's guided. And so in summary, I want to remind you that mindfulness is paying attention on purpose to the present moment without any judgment, and that you're capable of applying mindfulness to anything that you're doing or not doing at any time, anywhere, and that you can apply mindfulness into your practice of medicine. And it can be part of your self-care routine to help foster improvements in patient care as well. Please join us over at the Mindful Healthcare Collective. I founded this group a year and a half ago, and we've put on over 175 free online offerings that are led by physicians who have additional training in mindfulness, yoga instruction, as well as coaching. The Mindful Healers podcast is a podcast that I co-host, which has a mindful moment at the end of every episode where there's a guided practice. And then the 10% Happier podcast is also a good mindfulness podcast if you're interested. And with that, I'll thank you for your attention, and thanks for the opportunity.
Excellent. Thanks, Ni-Chang. And we have some questions that are coming in, and I appreciate those coming in. We will hold off on answering them until we get to our roundtable. Before we get to our next speaker, I just want to throw an interesting little tidbit on mindfulness in. UCSD, we all know it as a very large academic institution, and there is a lot of web traffic. You know, all the different programs, the School of Medicine, UCSD Health, they all have websites. Do you know what the #1 most visited website in all of UCSD is? It's the mindfulness website. Isn't that amazing? I found that really just fascinating. So Ni-Chang, thank you for this timely and excellent information. And we'll also come back, during the roundtable and also review some of the resources that are available. All right, and I'm happy to announce our next speaker here, Dr. Jeff Smith. Dr. Smith is an orthopedic and traumatologist who is going to go through and talk to us about what peer coaching is and what it means and how it can help us with regards to wellness. Jeff, take it away.
Make sure I'm unmuted. Yep. You guys can hear me all right? Cool.
Got you.
So I'm going to share a little bit of my story as well to help introduce this information. And so I love being a surgeon. It wasn't that long ago, though, that I wasn't loving what I had spent much of my life becoming. Coaching got me out of burnout and working on my wellness. It got me growing and thriving again. I also love being a coach. During the last 1 to 2 years, I've had a ridiculously high amount of personal and professional stress. While I'm not in a phase of thriving at the moment, I am still growing and definitely surviving things that I might not have previously survived without coaching. I don't have any financial things to disclose, but I'll share with you a little bit my what. In my main career, I fix broken people or put injured body parts back together so that my patients can heal, recover function, and return the work and activities that they enjoy. Through a 501c3 organization, I educate orthopedic trauma fellows and other surgeons to do that work better than me. And as a certified professional coach, I guide other surgeons to optimize or practice their best, succeed and achieve their goals, while taking on the challenges and stresses in healthcare, including moral injuries, so that they can experience wellness and sustainability. And at Surgeon Masters, we train physicians of all specialties to become physician coaches. My why, I had to discover in my phase of getting into coaching, but it was great to restore my purpose and passion in life. And I do what I do to make a major positive impact on other people's lives. In my first 10 to 15 years of my career, I was successful without using any of these practices, but it was not sustainable. And I was not as successful as I could have been. I did many of these the opposite, or what you might describe as the negative or pathological way, as do many others in healthcare, especially surgeons. It's not really important that as physicians we develop or use this methodology, but it is important that we have one that is based upon some element of research, that is performance-driven, and is reliable and adaptable. How many physicians do you know that are not, at least initially, very performance-driven? I was, and I still am. So what's changed for me? During much of my phase of burnout, it was coinciding with a lot of other things going on. And I was following my nephew, who was a high school pitcher with multiple scouts watching him pitch. And I was just sort of observing that process and noticing that there's many other industries that are focused on high performers and high performance. And even in medicine, there were writers like Atul Gawande that were evaluating what really makes us better. And it cued in the idea of coaching for me. And I kind of noticed that a few times, and I thought, you know, if I'd leave medicine, because I was considering it, I ought to have an exit strategy. And my exit strategy was coach training. Interestingly, my exit strategy turned into my stay-in strategy. I also started studying performance improvement and a lot of the things that I mentioned in the previous slide about how, because that how is also an evaluation of how we get better, how we improve, how we can manage wellness, how we can do just about anything. And what I learned was that my observations and intuition that the most successful professionals focus on best performance rather than worst performance. And I also at the same time started paying attention to my own wellness and to achieving goals while maintaining sanity. So how do high performers get better? Much of the science says that they have a growth mindset, that they deliberately practice. And they do something that I wasn't doing very well, which was incorporating rest and recovery. And they also have coaches. So what is coaching? Here's a definition by the International Coaching Federation. Partnering with clients in a thought-provoking and creative process that inspires them to maximize their personal and professional potential. You're seeing a lot of recurring themes between all of us as speakers. Through the Harvard Business Review, they talked about an inherently creative activity of bringing forth the knowledge, wisdom, and insight through active asking incisive questions, listening deeply, keenly observing, a dedication to self-awareness, and a commitment to learning. This was actually where I did my coach training. It was actually a 120-hour plus training. The coach coaching process helps bring out the best in you. This process is done by emotionally connecting your inner purpose and passions to outer goals and strategies to bring extraordinary and sustainable results. You might have had the same reaction that I had to these definitions when I was at my phase of burnout, because some of this stuff just sounded so crazy. And I can tell you this was a very growing experience and fairly uncomfortable for perhaps anyone but me as a surgeon. Why do high performers use coaching? I think it's because people, or when I pose this question to people and I have opportunity for immediate feedback, I get responses like, to get to the next level. So that athlete that's going from the minors to the majors, that resident going from one level of training to the next, or the resident or fellow going out into their first years of practice. Also, people say to get another professional's perspective, to address challenges or perhaps a decline in performance. Others will say to achieve goals or identify potential actions. And even a response of simply because it works, because it's been shown to work in many other professionals and other professions. How about you? Why do you do what you do? And why do physicians want to get better? Back to perhaps our early times in our career, unless you're at that point still. Maybe you still have that passion and desire to get better, but sometimes we have to relearn this. And why should we care about physician wellness? Why would morally injured or growth-oriented physician want to consider coaching? Well, the constructive feedback, challenging thinking, having someone to actively listen, curiosity, empowering questions, having an objective or detached involvement in things that you're trying to make better. And higher levels of coaching look at a very strict level of confidentiality, non-judgment, or shifting negative feedback to really constructive feedback. And having someone who cares, shows compassion or empathy for the many stresses and circumstances that other physicians experience. Also provide inspiration, encouragement, and having someone who is very adaptable to the individual. Some of the really critical things about coaching, or why coaching, would be that coaches place the client first, and a coach doesn't assume that the client would do what they would do. These are key qualities of coaching. These are key qualities of coaches. Let me shift a little bit as to how to be coached. Well, how do you do all the things that you do right now? Perhaps you might have a structure or a methodology for being coached, going through kind of areas that you want to be coached in. But again, it's not critical that you use this particular methodology, but having one, an approach, and many coaches have a system or a way in which they coach. And there's also a way that a physician client, can come to the coaching relationship and understand that there's a process and a relationship that you can benefit from. And what does the client or physician client bring to the equation? being self-directed, being accountable, being curious. Curiosity can kind of be demonstrated in many different ways. One, by listening carefully to the feedback or things that the coach has to say. Also seeking understanding, because again, this is one of the higher levels of communication, which is a back and forth to better understand each other, better understand the circumstances of the situation being discussed. To avoid defensiveness, where possible. I can tell you that's not an easy thing to do. All these are sometimes challenging and somewhat aspirational, but these are things that can be adjusted to basically create a focus on learning, growth, and improvement. These are behaviors of high performers. So just to share a little bit of the literature and science behind this, I would just say, pardon me that, I published an article on this topic in the Journal of Pediatric Orthopedics. The key point I want to pull out of that is just this comment that I made about perhaps a form of pure coaching will be a means to decrease the moral injury of physicians providing the care to our patients and their families. So I think pure coaching and integrating the skills of coaching can be done on a peer-to-peer level, and there's plenty of literature coming out showing that. Here's one done in internal medicine that demonstrated the effect of professional coaching on well-being and physician distress. And it showed that there was an impact to satisfaction, well-being, and resilience. So whether it's juggling the many priorities that we have in life, addressing burnout, focusing on a skill or technique, those skills don't have to be technical, they can be soft skills. Addressing burnout, climbing the challenges or moving from one level to the next in a career, or a transition from one type of career to another type, or dealing with the marathon of a medical career. There's so many things that people can benefit coaching and being coached on. And in particular, as our subject tonight, I would say even coaching in the area of wellness and well-being. Thank you for this opportunity to share with everybody.
Excellent. Thank you, Jeff. Appreciate the comments and the information. Okay, so we'll go ahead and stop the screen shares, and then we will bring our panel back here. There was a couple of questions that came up. I'm going to start with a couple of easy sort of technical ones. And are we aware of any mindfulness resources that are available in Spanish?
Yep, I will go ahead and put in a link in the chat box for people. Excellent.
Thank you, Mi Chang. And also the second question here is about website listings for the mindfulness. I will tell you that the County Medical Society up on our website does have a list of wellness resources, and we've tried to keep that list as current as possible. We will also make sure that all of the websites that you have seen here in the presentations this evening will also be listed there. I believe we have many of them already listed, available, so you can use that as a main resource to getting to this. This next question is a little tougher. It's one of our colleagues who is in some distress right now, and I wanted to talk and get the group's help with this one. But this is someone who is having some issues in dealing with the Medical Board of California and the punitive nature of the medical board for a what seems to be a simple post-operative complication that was anticipated and discussed in the consent and no long-term outcomes. And we have a colleague here who's suffering and is in distress. And I wonder if our group has comments or recommendations to help our colleague here.
Yeah, let me, if I can, make a comment. I mean, obviously, it's very difficult to directly address the immediate distress that someone like that is experiencing. I can certainly say that I can relate, and there's a very large percentage of physicians throughout their career that are going to experience this particular situation of having an accusation either coming from the medical board or malpractice situation. There are, to my knowledge, I don't know specifically with the doctor's company, but I do know that those organizations that involve our carriers do have resources. I suspect the San Diego County Medical Society might have a resource for that as well. But I would say that it's one where in general, people benefit from reaching out, not just the resources, but to people that can be there for support. That can range anything from a coach, a mental health professional, counselors, and even in my experiences, in my career of about 20 years, I've had a substantial litigation about every 5 to 10 years. Had one while I was in academic practice. I had one in sort of the peak of that burnout. And in both of those, I successfully defended myself, but the stress was phenomenal. And I'm in the middle of another one so I can certainly appreciate that distress, and just would encourage anyone in that situation to reach out to an appropriate caring colleague for some support and guidance.
Yeah, thank you for those comments. And I want to really talk about that and expand on it a little bit more. But, I was been taking notes throughout all the presentations. And when that particular question came up, I really can empathize just because of the work that I do as a day job and helping to run the UCSD PACE program and seeing a lot of physicians in distress. And the one word that I wrote was connections and connectiveness. And, Jeff, you talked about making those connections and about reaching out to those around you. And I think that the more support we can get from those around us, from peers, from colleagues, but in this case, also from attorneys. And, you mentioned about discipline and how stressful that is. We know that an average physician will likely get sued about once every 7 years, I think is where the statistics are at. And it's a very, very stressful time because we already place high standards upon ourselves for always being perfect. And we know that reality is not like that. And it becomes very difficult. But I think the reach outs to, if you have a well-being committee at your institution, whether it's on a hospital medical staff or a med group, I think reaching out to peers that you work with, I think reaching out to coaches, as you mentioned, I think looking up resources that are immediately available through we have some listed on the County Medical Society website, but also reaching out to attorneys and good attorneys that have experience in defending physicians with these particular matters. There's always kind of the joke about the doctors and attorneys are always at war or against each other. But I've really found that the attorneys that work with physicians who have had any kind of legal issue come up they've been very supportive. They have a great sense of what the physician is going through and have a number of resources available as well. Now, I know that, we can't fix everything right here, but I just come back to that issue of getting connected and reaching out and not suffering alone. All right, we've had a few other things. People are putting some comments in the chat, and question and answer or chat is fine. Is a coach like a therapist, and how often do you meet with them? Jeff, let's throw that one your way.
So probably the best way to describe it is that coaching really by definition is not therapy. And again, there's the verb to doctor or to nurse, and then there's doctors and nurses. People can use the verb, use coaching or coach, but as a professional, coaches are not therapists. But they can be complementary. I know of several physician coaches that collaborate with mental health professionals to provide sort of a combination of services. I also know that can be done separately. So a coach may work with a client and address mental and emotional issues as part of a function, but they're perhaps less addressing the mental health and more just helping them process managing actions and plans. I think that might be a fairly good way to say it. And as I said, I think they're complementary professionals.
Great. Excellent. A couple of other things that have come in that Elisa Speziale, who's on our committee, states that they have helped establish some counselors at the institution, and they are available. So again, part of overall wellness. Byron, before we get on to some other questions, I wonder if you can talk about, with your knowledge of what's happening with regard to a questionnaire that's going out to physicians at UCSD as a pilot project, and there is that space in there to mention gratitude. Are you familiar with that program?
Unfortunately, I'm not sure. There's a lot of people putting together various surveys. I don't think we have a unified coordinated survey as of yet, but I'm not familiar with one that's coming out right now.
Yeah, there's one that's going to be coming out. Maybe I can just touch on it a little bit. We have a Chief Experience Officer, Dr. Tom Savides, who is also a member of the Wellness Committee. And right now they're sending some surveys out to staff in general. And the idea here is that a periodic survey, a very brief one, again, you can use a QR code on a phone to do that. And it is a way to elevate issues that might be problematic for your day-to-day work. And that can then be raised to a higher level so that it's addressed and people can feel that there's communication coming back for any issues that might be impacting them. And the other part of that is listing someone who you would like to name and giving gratitude to. So again, a more formalized way to offer that gratitude, because, as you mentioned, the data really shows that being able to give gratitude and to receive gratitude is one of the easiest ways to really elevate that good sense of well-being. All right, I'm just going to read this one out and throw it out. It's with regard to a public figure. Chief Medical Officer Nick Efantides was recently in the news. He was on medical leave due to burnout. Upon his return, he was fired. How can organizations work in conjunction with their staff to show support rather than punitive actions? This may send the wrong message to physicians and other organizations who are hesitant to take time off and let their colleagues know. And again, we can't speak to this specifically because we certainly don't have the answers, but I'm wondering if the panel in general will talk about how might we help colleagues that might end up into a situation that doesn't seem quite right.
I can say a couple things about that. There's certainly at UCSD, we've had kind of ongoing gradations of peer support. And as I hope my my presentation kind of implied, there's no amount of support that's too small. The high fives in the hall, the thank you, hey, I recognize what you do. But well, not necessarily, but there is value into formal systems. And, for example, our anesthesia department has a peer support group. We've partnered with the surgical peer support group, and whenever there's a traumatic incident in the ORs, we're notified and we contact those people, and all the people on the group have been trained and know how to listen and help. Not therapists, of course, but as peers. So I have found that to be extremely well received and very helpful. And personally, I mean, we did it with no money. We've just done it with interested parties, and what I have found, it's not very hard to drum up interested parties when it comes to this kind of thing. So I can't say specifically with that issue, but I do know peer support is something you can start practicing tomorrow, and if it's something that that you feel is working and doing well for you and your colleagues, it's not hard to set up systems where there's a little more infrastructure to it. And that's something I'm happy to talk about if anyone has any questions. And I'm sure I'm not the expert in it. I just have experience with it, but I'm happy to talk about it further.
Yeah, and I think one of the issues I think to bring up is that we are talking about physician wellness. We are talking about stress. We're defining it. That message is getting out to the public, where we can reach out, and it does not. It's I guess the word I'm looking for is destigmatized, and I think that we need to feel comfortable in reaching out, and it's not a sign of weakness to ask for help or to reach out to peers for a little support now and then.
And I would just add to that,
Mm-hmm.
we, when we implemented peer support, we stood it up during the pandemic, so that affects everything, but we employed a proactive model. So we didn't wait for people to reach out, and two, for something to happen. We just assigned everybody, all the peer supporters had people they were supposed to reach out to. So I think something like that maybe helps us catch some of this upstream and also destigmatize the idea of connecting and reaching out. And then I think the other part of it is that to some degree, we want to lead by example. So I'm very vocal about the things I'm doing for my own well-being. I'm very vocal when I am feeling a little bit burnt out and need to, scale back in one area or another. And I think the more we can do that, and the more particularly our local leaders can role model, you might just affect one person, but it might encourage that one person to go seek out a therapist or take some time off or do something else. And so that, I think, can also be really impactful.
Mm-hmm. And Ami, there was a sort of a corollary comment that came in with regards to what have you found to be effective methods to communicate with leadership within the departments about the importance of system-wide change in programs to address burnout?
So a few things come to mind. One, there is a growing body of data out there. You don't have to look far to prove what happens when physicians are burned out and what happens when we, do things to support their well-being. So it depends a little bit on what your leadership responds to, but if it's data that is out there, there's also benchmarks from the AMA and from a variety of other organizations. A lot of institutions across the country have really established entire offices of well-being and resilience. And so if that's something that your leadership responds to, then that's another area to look at. And then I would say the other part of it is really just, listening to your leadership as much as you are talking to them, because in the listening, you'll likely identify some mutual pain points or identify a pain point of theirs, which you might be able to help address by, supporting well-being. And so if you can sort of meet either a mutual goal or alleviate one of their pain points with a strategy that you want to apply, then that can also sometimes be effective. So those are the few things that come to mind offhand.
Yeah, thank you. And I think the data speaks loudly as well. And, people like to see data, and the fact that, when wellness is improved, patient care improves, costs go down, et cetera, things that you were mentioning during your talk that are so important. All right. Again, we're gonna start to wind things down a little bit here. I just wanted to make sure that folks on the call know that the Wellness Committee is well represented from multiple groups in town, but also individual physicians and private practice doctors. So I believe we have good representation. We're here to listen. And if you believe there are things that we can institute to impact the community as a whole, please let us know. I will tell you that, I think, I can't remember if it was Ami or Nichang that talked about our physician groups that we used to have available that were organized through CMA. You'll be happy to hear that we are entering in a grant application mode here to try to reinitiate those programs through the County Medical Society. We've passed the first hurdle with regards to that. It's not funding in hand, but we have at least passed phase one, and we're looking to resume those programs because we had such good response from them. And again, we heard from the data, the effects of those programs last, a year and perhaps even more. So I'm happy to report on that as well. So I think what I'd like to do in the last couple of minutes is Dr. Liang has so graciously accepted my invitation to lead us through a mindfulness exercise here as we close for the evening. So I'm going to turn things over to Nichang.
Thanks. And thanks everyone for all the questions and the sharing. So we've had a tremendous last year and a half of witnessing a lot of suffering. And so I wanted to just bring in a little different flavor of mindfulness into a loving kindness practice. And so if you're comfortable doing so, go ahead and closing your eyes and placing your hands over your heart. And actually this position and pushing a little bit against your chest, this actually can give us a little micro dose of oxytocin, our feel-good hormone, our bonding hormone. And so this is a posture that you can take if there is a lot of suffering, in respect to not trying to alleviate the suffering necessarily, but because you are suffering and you're showing yourself a little bit of kindness in that moment of suffering. And so I'm going to invite you to notice the sensations of the palm against the chest. And then recall to your mind's eye a loved one that has bestowed upon you unconditional love and that you have shared unconditional love with. And you can wish these kind and loving intentions to your loved one. May you be well. May you find peace. May you be happy. May you be safe from harm. May you be well. May you find peace. May you be happy. May you be safe from harm. And thanking that loved one for being part of this practice and bringing about gratitude for the role that they have played in your life, bringing into your own mind's eye an image of yourself and wishing yourself those same kind intentions. May I be well. May I find peace. May I be happy. May I be free from harm. May I be well. May I find peace. May I be happy. May I be free from harm. And then for everyone that's here on the call together tonight, kind of extending those loving and kind intentions to everyone that's on this call tonight, yourself included, in a collective experience of sending out loving and kind intentions. May we be well. May we find peace. May we be happy. May we be free from harm. May we be well. May we find peace. May we be happy. May we be free from harm. And then coming back into noticing the sensations of hands over heart. Perhaps noticing how you're feeling now compared to just a few minutes ago. Blinking open eyes, letting the light back in, noticing what's here for you now, and being very intentional about sending out loving and kind intentions for everyone here and also for yourself. Thanks.
Thank you. That was wonderful, and what a great way to end this meeting. Thanks again to all of our panelists. Thanks again to all of the participants who were able to make this a really great evening for us. And thanks to the County Medical Society, Paul Hedgie, Jen Olmstead, and all the rest of the staff who helped make this possible. And also to the Doctors Company for helping to support this wellness activity for us. All right, everyone, have a great rest of the week and a wonderful weekend. And please reach out and utilize some of our resources and let us know how we can be of help.